Hello, everyone. My name is Roderick Campbell, and for my first current event, I decided to research and present on something that I've always had questions about, which is healthcare reform and what that can look like within 2021. There are a multitude of different healthcare issues and problems that we have in the world today, especially in the United States. But I chose to start with healthcare reform because everyone, in some way, shape, or form, has to experience have to have experience with this. I also chose this because it is something that I can speak on because I have firsthand experience working in the pharmacy. I am a pharmacy technician, so I'm learning every day about the different nuances and problems that can come without being insured in the United States. I've researched some of the issues that we have within healthcare today, but what I'm most interested in are the problems that we are able to solve and the solutions created to have a more efficient healthcare system that could eventually cover all its citizens. Now, in the second slide, I'll be outlining what I'll be presenting on today. I think answering the question as to why healthcare reform is important is, very essential. A lot of people do not have the same thoughts as to why we should have healthcare reform. Some are in favor of healthcare reform, and those are people out there who aren't as well. For me, it comes down to who is it benefiting and the importance of money. I think the importance of money plays too big of a factor when it comes to people's lives and well-being. The second part I'm going to talk about is my firsthand experience in dealing with people who aren't able to be insured for medications in the pharmacy at Walgreens. And the third part is the AHA article that I found. It's a journal article, and it had some great information, and it provided me with these principles. It had 7 principles that it laid out, very clear cut and concise, that I thought was awesome. And it provided solutions to how we can go about solving this issue of healthcare reform. And they had 7 different principles. So I'll go through each one of those principles and stating what they are and how we can apply it to healthcare reform as a potential solution, I think, and fixing this problem. And the final thing that I'll go through is my conclusion and everything that I've learned through doing this research, and my final thoughts on what I think the future of the healthcare reform in the United States will look like. For me, I believe that healthcare reform is important because I value the lives of every single person who is uninsured. And before the Affordable Care Act was established in 2010, there were over 50 million people who were uninsured in the United States. Now, since 2010, we currently only have 30 million people who are uninsured. I'll repeat that. We currently have 30 million people who are uninsured. And I say that to say 30 million people is way too many people for a country like ourselves, the United States, who thrives and take pride in being the best, but we have the most expensive healthcare system, but not the most efficient. And I look to a country like Canada, who has universal coverage, and I wonder if America can get to a point where we can have universal health coverage as well. I also think that healthcare reform is important because I think that we're shifting more towards preventive and value-based care. And that's prevalent because not only will preventive and value-based care save money, but it will also save the lives of patients who are able to get appointments for screenings and detect cancers before they become deadly. There are far too many stories where people say, I don't have enough money to go on and get an appointment, or I won't be covered by this, therefore I didn't detect this cancer. And if there were more preventive measures and investment in the public health sphere for that to be allowed to happen, then we can start the conversation of everyone being able to be insured under a plan that fits them and have universal health coverage. One of my first experiences with a genuine health insurance issue was during my first couple of weeks as a pharmacy technician at Walgreens. There was a man who had gotten a prescription for years, but his insurance policy had changed within the new year and did not cover the drug anymore. This led to me being cursed out and screamed at, but there was nothing I could do to change the outcome. This is where I started to wonder about how health insurance works and who was eligible to be covered. It seemed to me like if he was covered before, why change it to where he isn't covered now? And how many other people are affected by this? This is only one example of getting a prescription, but what about those who need medical attention as well? Another experience I had was with a lady who was prescribed a prescription but didn't have any insurance because it was too expensive. The drug was very expensive as well, but she needed it and didn't know how she would pay for it. At that moment, she began to break down in tears and despair because she didn't know what to do. And I sat there teary-eyed and feeling helpless because I didn't know what to do either to help her. One of my pharmacists then said to me after the lady left, she said, "That's how it is sometimes. It's not right, but that's how the system is. If you don't have the money, you won't have the access." And that statement, when she said that to me, really stuck with me for a long time, and it inspired me to want to change the current healthcare system that we have today to where money is not an impediment for people getting the healthcare that they need. The article that I found and will be basing a lot of my research on is this article from the AHA, which is the American Heart Association, which was published in March of 2020 and titled Advancing Healthcare Reform, the American Heart Association's 2020 Statement of Principles for Adequate, Accessible, and Affordable Healthcare, Presidential Advisory from the American Heart Association. And this article is very intriguing to me because I thought it had a very impact and it was very informative on the solutions rather than listing out everything that's wrong with healthcare reform. It provided solutions to how we can go about making healthcare more accessible to people who don't have insurance at the moment in 2021. And what they provided was a list of 7 different principles, which I will go through and explain and also show how the impact of those principles can be applied into what we are doing right now currently to help the 30 plus million people who are uninsured. These principles from the American Heart Association on healthcare reform are what they believe to be critical principles that must be satisfied to achieve healthcare that is adequate, accessible, and affordable for those living in the United States. Principle 1 states that all people living in the United States, regardless of health condition, should have comprehensive, understandable, and affordable health coverage. One of the main goals of health coverage is to ensure the provision of medical care for individuals when it is required because of their illness or injury. The notion that everyone should have access to healthcare is important, in my opinion, because not everyone wants universal coverage. Implementing universal coverage will not be a monetary advantage for those who try to dissuade others into thinking that the current healthcare system is the best and most efficient. In other words, there are people out there who do not want to see the whole country with universal health coverage because it would not be an advantage to their financial responsibilities. This is the first step into changing healthcare reform, because if everyone is on the same page and agrees that we want universal health coverage, then we will be able to start to make progress and lead in the right direction as far as getting the 30 million plus people who are uninsured today the insurance that they need. The second principle that the American Heart Association states is that all people living in the United States should receive high quality, affordable, patient-centered health care. And the word patient-centered is very important because it recognizes a shift that we see in our culture and society today and how we view medicine. So according to the Institute of Medicine, which is now the National Academy of Medicine, they identify patient-centeredness as a key element of care that is safe, reliable, and responsive to patients' needs. In recent years, patient-centered approach to healthcare has taken on a greater importance in the development of high-quality healthcare pathways to increase emphasis on care coordination, shared decision-making, informed consent, patient preferences and values, and other measures to integrate patients and their families into the care team. The New England Journal of Medicine describes patient-centered care as having a shift in traditional roles of patients and doctors from passive to a more involved team member. This collaboration, in my opinion, can help build relationships and minimize healthcare costs. So we see the shift from people just taking the doctor's word for what it is. Not that we shouldn't, but it's more of how can I be involved with my own healthcare plan? I'm not just going to sit back and be passive about it, but I'm going to be proactive and learn things because we have an abundance of resources at our fingertips with smartphones and the internet, and more people are becoming aware and enlightened by their conditions and want to collaborate with the doctor rather than just being told what to do. The third principle that the American Heart Association states is that all people living in the United States should have guaranteed access to evidence-based preventive services with minimal or no cost sharing, regardless of how they gain coverage. Evidence-based preventive services improve health and reduce premature deaths by identifying illnesses earlier and managing them more effectively. The value of offering evidence-based preventive services free of cost to the individual are of an utmost importance because we are rebalancing our healthcare expenditures toward well care from the heavy emphasis on sick care. We can help monitor cardiovascular risk factors such as smoking, unhealthy diet, and physical activity. When we recognize these earlier, we can save money, time, and our efforts on sick care, which is secondary and comes after the damage is already done, rather than investing our time and money into preventing these things from ever happening. And the evidence demonstrates that having better preventive care will reduce chronic illnesses and disability, along with high cost care of the treatment to manage chronic conditions. The fourth principle that the American Heart Association states is that race, sex, gender, and geographic disparities in health and healthcare must be eliminated. Now, when I first read this, I thought to myself, well, that seems pretty obvious, and it's one of the most prevalent, problems that I think we have not only within healthcare reform, but in the country as a whole. And one of the solutions to fixing the problem with race, sex, and gender and geographic disparities in health and healthcare are that federal and state appropriations should facilitate needs-based, culturally appropriate allocation of resources that improve population health. And I see this happening in places like St. Louis and Chicago, where there are food deserts in the inner cities that are not present in, more affluent suburban communities. Now, why is this? This is because of the system that we've lived in, and we're so accustomed to, you know, black and brown people specifically not having access to the abundance of resources as their white counterparts. And this is something that I'm very passionate about and look forward to continue to learning and being a advocate for, because I think once we eliminate these health disparities, more and more people will become able to trust the healthcare system and be more insured in the years to come. Patients should also be supported by the health system to be active participants in their care, and clinical trial participation should be robust, diverse, and representative of America's changing demographic composition. Too many times we see these studies and different things that we think represent the country and the people who we are surveying, but in reality, not enough representation is being held because black and brown people do not feel comfortable within these studies because of things like the Tuskegee, syphilis project and things like that. There's just a mistrust, which is another problem within itself that leads to there being a health disparity within our country. So minimizing the carrying distribution of health disparities and ensuring equitable distribution of resources will be essential for ensuring the economic and social strength of our nation. The fifth principle that the American Heart Association mentions is that public health infrastructures should be strengthened to effectively engage diverse stakeholders in multiple sectors, to adequately respond to social determinants of health, and to support the elimination of systemic inequities in health and healthcare. The public health infrastructure is necessary to provide communities with the capacity to prevent disease, to promote health, and to prepare for and respond to emergency and ongoing threats to health. Greater investment in public health and social services has the potential to improve disease mortality and morbidity, and we have the significant healthcare cost savings. The U.S. healthcare system needs a tighter social net, the AHA recommends, and that we have a greater focus on enhancing health counseling, expanding nutrition and physical activity programs, which would increase the availability of quality, affordable housing and public transportation, and engaging more caseworkers and community health workers and patient and consumer outreach, with the potential for raising the social impact. In addition, health programs should be resourced to support an adequate response to the inequities relating race, ethnicity, sex, gender, and socioeconomic statuses and cultural differences that we see in the United States. The sixth principle that the American Heart Association mentions is that the U.S. healthcare workforce should continue to grow and diversify through a sustained national commitment to a culturally competent public health and medical education and clinical training. When I read this, I focus on the word commitment and diversify. And this means that we have to have a commitment to diversity at an early age. And this is one of the solutions that the American Heart Association proposes, is that starting even from pre-kindergarten, we need to have an early exposure, to minorities in the clinical workforce. Because right now, racial and ethnic minority groups make up less than 30% of the total U.S. population, but represent only 11.5% of our clinical workforce. And with this article as well, is stating that Black women are becoming doctors at a higher rate, and that we are investing more of our time and resources in having a more diverse healthcare workforce. And that comes through training and just being more open to having people who may not necessarily look like you a shot within medical schools, and just letting them know that the resources are there for them to be successful. The seventh and final principle that the American Heart Association suggests is that there needs to be a support of biomedical and health services research, and that should be a national priority. And inflation-adjusted funding for the NIH, CDC, and other agencies must be maintained and expanded. The consistent funding of research, both public and private, provides an important signal to existing and potential young researchers that there are rewarding and substantial career paths that exist in the sciences. These investments are critical to encourage a diverse pool of talented young researchers to both begin and continue their careers in the biomedical science field. Adding knowledge of what should be defined as quality care through clinical redesign and the study of new and alternative pathways of care will be vital to healthcare reform. As I finish up my research on this topic, I realized a couple things: that healthcare reform is something that we've been trying to tackle for decades, and that there is always more than we can do and that we can learn about the situation to help others. And from what I learned, one way isn't going to be 100% perfect. There are always going to be certain groups of people that have a problem with who's getting what and who's getting covered or not. My biggest proponent is we have to want change. We have to want to see people in our country have access to the things that they deserve, which is healthcare when they need it. Not who can afford it, not who has access to this or who knows who. America should have a healthcare system that is much more efficient and much more available than it is today. Here is a list of the works that I use to cite and present the information today, with the American Heart Association article being the most prominent that I use. And I also have the New England Journal of Medicine article, What is Patient-Centered Care? I think these works are great, and I think you guys should check them out as well. Thank you.